Hey y'all, and welcome back to my channel. On this page, I talk about technology and money. If you're new here, please consider liking and sharing the video and also subscribing to the channel. I appreciate it. So I wanted to do a quick video on this article I came across on Becker's Health IT. Now, if you've watched any of my previous videos about if you're a registered nurse or a clinical person looking to transition from the bedside into tech or informatics resource and looking for resources to find out what's happening in healthcare technology or just even healthcare in general in terms of conferences, news on startups, new technologies coming in healthcare. I have talked about Becker's in the past. Becker's healthcare has a lot of tea, right? There's a good resource, and they have various like newsletters that you can subscribe to get like breaking news and things like that. So this is an article that came out in Becker's about 3 days ago. I'm getting caught up on my emails, and I saw this, and I wanted to share this and do a quick video about registered nurses working in tech. Now, I did a video yesterday based on some comments that was on my TikTok, and also just things I've heard from people in general, or folks sending messages saying, I didn't know registered nurses could work in tech, or even that registered nurses could lead technology organizations, or just registered nurses having value, or licensed LPN, licensed practical nurses, or even nurses assistants having value in tech. So I wanted to share this article that was in Becker's, and I'll be sure to leave a link to this article in the description about the new, well, she's been in her role since spring, but about Ellen Pollack, how she went from a registered nurse working at the bedside. Many of us start at the bedside to now chief information officer of a major health system. I believe UCLA Health has about 1,000 beds, and they have several hospitals. That's a very large health system when you have several campuses, multiple hospitals. So this article in Becker says from RN to CIO, or from registered nurse to CIO, UCLA Health's Ellen Pollack takes unique path to health IT exec. So Ellen, it looks like she does have her master's degree in nursing. So Ellen Pollack, MSN RN, took a non-traditional path to become CIO of Los Angeles-based UCLA Health. Well, I want to take a moment here and just pause. And as I said about a minute or two ago, for a registered nurse to be in a technology role and leading a multi-campus major health system in a major city. This is even if the city was somewhere in the middle of the country or deep in the South in a rural area, it doesn't matter. But the fact that it would still be significant. But the fact that there is a registered nurse in a position in a C-suite role leading a healthcare technology organization for a major health system, major academic, because it's associated with UCLA, which means that it's the academic, right? So to be leading an organization that large as a registered nurse is very significant. And I wanted to take a moment to underscore that. All right. So the article goes on to say she started as the director of nursing there 26 years ago before taking an interest in project work. She oversaw electronic health record integration and deployment, then became the chief nursing informatics officer. So that's the CNIO role. So I've talked about what a CNIO does in a previous video where I talked about where I gave actual job titles of registered nurses working in tech, and CNIO, or chief nursing informatics officer, was one of those positions. So she was named the permanent CIO at UCLA Health in April after the system's previous IT leader left for the same role at Palo Alto, California-based Stanford Healthcare. So the article goes on to say, Becker's interviewed Ellen Pollack about the evolution of health IT or healthcare technology and what someone with a nursing background brings to the CIO role. So this is where I say registered nurses, that you have options. Your clinical, and I've said this in previous videos here on YouTube, and I've also said it on TikTok, nurses, your clinical experience, your clinical knowledge holds a lot of weight in healthcare IT. Please do not underestimate, or I cannot underscore enough how much value your clinical knowledge of workflows, working with patients, being able to work with multidisciplinary teams from pharmacy to physicians to food and nutrition to physical therapy, and just understanding the nursing process and applying that to healthcare tech, or just even if you're not working in healthcare tech, you're just working in tech, how much your clinical knowledge and experience, how much that holds weight. So one of the first questions they asked Ellen was, what has changed most about health IT since you started working in it? She goes on to say, it's dramatically different. When I first started in health IT, we were very much a best of breed. I say that loosely because people thought when they bought an electronic record system or a radiology system, it was the best. But by 10 years later, it wasn't the best of breed, right? Because if you know anything about technology, not even healthcare technology, just technology in general, it's always changing. It's very dynamic. By the time you buy the iPhone 14, I trust and believe, I'm sure they're already working on iPhone 16 or 17 or something, some type technology that the military is working on now that we may not have access to as general public for maybe another 5 to 10 years. So she goes on to say, just talking about the systems they bought in the past, just having tons of separate systems that didn't talk to each other, or what we call integration, making it difficult to coordinate care. Finding the data you needed was very painful. Physician practice was on paper, both on the ambulatory side, so that's outpatient, and the inpatient side. She goes on to say they have transformed their IT organization, their healthcare organization. And then she talks about the system that they purchased, which I just learned. If you all did not know, I just learned within the last, I believe 2 months, that Epic is no longer the number one electronic healthcare record in the world. It's now Cerner, and I believe that's because the Veterans Affairs healthcare system, that's a national healthcare system, purchased Oracle Cerner. So now Oracle Cerner is now number one. All right. So then the question, this is really key, y'all. So Beckers asked Ellen, how does having a nursing background help in the CIO role? And then Ellen says there are at least 2 flavors of CIOs. There's the traditional technology background CIO, and there's the more of the clinical focus one. In recent years, we're seeing a shift toward valuing the clinical focus, period. Because no matter how great you are as a CIO, you likely have spots where you have to rely on your technology leads for their expertise. And so as a clinical background person, I have to really rely on our chief technology officer, our chief information security officer, our analytic officer to really provide the strategic direction or oversight for these areas. But the value of having a clinical person is the understanding of what the clinical problems are and being able to really translate those to the technology teams. As a registered nurse, you know how a registered nurse thinks, how a registered nurse works, etc., how we care for our patients. So what sets our team apart from many teams is that we have a very strong clinical informatics department. We have our chief medical information officer, which is, that's typically a physician. We have our chief nurse informatics officer. Both of them sit on our leadership team within IT, and we make sure that we connect very, very closely and deeply with our clinical operations, so we understand what their pain points are, what their hopes are, what their strategic objectives are. So one thing I wanted to point out here is about what she says about their CISO, which is the Chief Information Security Officer. So I was at the American Nurse and Informatics Association annual conference in Florida back in spring, and I did meet there was a CISO there who was a registered nurse, and that was the first time I've ever heard of a Chief Information Security Officer being a registered nurse. So I know that there are nurses now. Now, at that point going forward, I now knew that there are nurses working in cybersecurity. All right, going on to how else the CIO role has changed in recent years. Without our workforce, we cannot accomplish anything. That landscape has totally changed. Our competition used to be the LA market. Now that she's saying, but now with so many fully remote options, people can live anywhere and work anywhere. And in order to keep our staff, we have to be more employee focused than ever before. So then she talks about creating a work environment that's engaging, high growth within technology, and also career ladder, how to pay people effectively to keep them, how to build sense of team, connecting staff to the mission, etc. And then they ask her about staffing and other health technology issues that they're spending that she is spending the most of her time on. She talks about IT security. Then she goes on to talk about clinical practice and clinical research. And then wrapping up this interview, they ask her, what IT projects or innovations that she's proud of. So she talks about some things that her organization did throughout the last 2.5 years and beefing up their cybersecurity, in addition to embracing more with like telehealth and implementing inpatient video visits, etc., and just being adaptable and finding technology solutions for whatever, here she goes, finding technology solutions for whatever the clinical problem was of the day. So that to me speaks to her as a leader and her as a leader of that organization being very nimble and being able to respond to whatever clinical operational demands are going on at the bedside or in the hospitals. And then they ask her, what would you say is coming for the future of health IT? And then she goes on to say, one of the things we're going to really be focused on is continue to work on the patient experience and our digital front door, how easily we allow our patients to access us in whatever mode they want to access us. So to be that maybe mobile, right? On the go, wherever, like if I'm at the grocery store or wherever I am, if I'm at home, being able to access, my electronic health record or et cetera, where I want to go. And then she talks about their organization having a digital patient experience governance group, which is great, right? Because you don't ever want to forget when you're working in healthcare, whether you're in tech, hospital supply chain operations, et cetera, that we never want to forget the voice of our customer. And the voice of our customer, our primary customer, is always the patient. To me, even though you're in healthcare tech or you're in healthcare tech, the patient is at the center of everything that is being done. Let's see. She says health systems, Becker says health systems structure their CIO positions differently, with some having digital or transformation in the title. Now, this is something that I've seen. I've seen some organizations, instead of having CIO, they'll have a chief digital officer or a CDO or a chief transformation officer, CTO, not to be confused with a chief technology officer. And they ask her if there's anything unique about her role. And then they ask her, being Becker's, asking her about how her IT organization contributed to making UCLA Health one of the top rated hospital systems in the country, which you think about again. I'm going to underscore this for the last time, that for an organization of this size and one of the largest, one of the major cities in the world, having a registered nurse leading their IT organization is very significant. And then she goes on to say, what she thinks makes them one of the top health systems in the country. And she said, it's our relationship to operations, whether it's the business office, finance lab, radiology. We have people who are responsible for those relationships and often attend their leadership meetings and are really embedded. So they're not an afterthought. We are at the table to help think through it and then offer technology solutions. So that's it, y'all. I'll be sure to leave a link to this article in the description box. But I'll say it again. I've said it before. Registered nurses, you have options, okay? There are nurses in unique roles in technology, in healthcare technology, making a difference. And so please do not be discouraged. Know that you have options and your clinical experience holds a lot of weight. That's it, y'all. And I'll see you in the next video.